Anything else on this issue before we move on to the next category? And if not, I'll ask the panel. Any comment on gap beyond what our audience has shared with us on gaps in clinical care and research? And please word it as a gap.
I have one more.
Yes, Dr. Neville.
Okay. I think that there's a gap in late survivorship issues. I have identified that once people are moving on into survivorship, they need to tell their story. Individuals need to tell their stories. Family members need to tell their stories. But once at a pivotal point, at a point where, I don't know if it's the development of PTSD or they've lived it, they've been immersed in it, they're exhausted of it, they just want to move on, that they are no longer willing to share their stories. And it really poses a difficulty in accrual of participants for research. So I think that timeliness in survivorship in particular is very important. There's a certain time when they don't want to do it anymore.
Dr. Cunningham, a gap.
A gap. I think that there's a gap in our knowledge regarding the most effective models of care. I did touch on it a little bit, but I want to make sure it gets into the gap list because I think it's really critical. Figuring out what are the best ways to care for survivors, and in addition to build on Dr. Neville's point, the late effects and interventions to what intervention research do we need to try to ameliorate some of those effects.
Thank you. We're going to move on to the next category. There's crossover between them. Do you have another gap, Doctor?
One more gap in 7 words. So a gap in evidence-based medicine to support or establish standards of care for treatment.
Great.
7 words?
Thank you.
Maybe 8.
It was great. All right, we're going to move on. And by the way, of course, there is some washover from one of these categories to the other. So at the end, we'll just allow a free form for comments. But let's try and stay with this so that we can organize ourselves and create an action plan connected to it later. Long-term effects. Long-term effects. Where are gaps in long-term effects? Gaps in long-term effects. What we know, what we let people know. Go ahead. Yes. Oh. And then.
Long-term effects. A gap would be one that we already recognized, which had to do with just finding the population when they are kind of, done with this and not wanting to talk about it anymore. Another one is just kind of getting organized and having resources, deciding if the standard of care is going to be that the primary care person who maybe diagnoses in the pediatric world one patient in their perhaps whole career, and then are they going to be the person following that patient or not? So who should be the following? And if in fact it should be the world of the oncologist slash wellness slash integrative medicine folks, should in fact we look at how do we develop those models of care. And there are some documents that the Children's Oncology Group, Late Effects Group, is putting into print. There is a website that is related to Children's Oncology Group that is both a public forum, but there's a huge amount of research related to the pediatric population that's going on, and I have no wisdom or knowledge of what goes on in the adult world.
So let me see if I understand the gap. Is the gap that we truly don't collect systematically information on late effects and collate that into a body of knowledge?
I believe that to be true in the adult.
Okay, I just want to make sure I'm not paraphrasing you incorrectly.
Right, I believe that to be true in the adult world. I think that it is a very narrowing gap in the pediatric world.
I hear. And before I ask the panel, as always, I'm going to ask the audience, do you have any other comments about gaps in late effects?
I'm not sure if where this fits, but I figure this is as good a place as any. But just sort of in the public perception, and this again goes back, we like share a brain, exactly to what Matt was saying, but just about, I know I get this a lot. I'm, about 5 years out of treatment, and people say, oh, you look great, and it's like an afterthought that I ever had cancer, and it's something that I continually deal with every single day. And just sort of changing the public mindset that it's not, you're out of chemo, you're cured, boom, it's over. Like, you know, let's go on to the next thing. It's a very fine line because I know that you know, I'm not bald anymore. I look much better. You know, I am overall much more healthy. But just for something that a lot of people deal with still internally and just, you know, like you were saying, with jobs and just all these late effects, just sort of, I guess, educating the public that it's not, you know, you're finished with your chemo, you're finished with your radiation, and boom, that's it.
So the gap then is in a lack of public understanding that effects can go on for people and that those people want to be talked to in a way that doesn't cheerlead. You know, I'm sort of putting that word in here. I know you didn't use it, but I thought I heard in there, you know, that, oh, you look great, and just, right. So that's where that gap is, public understanding that you need to be sensitive that those effects may go on and on for a person, and it is both okay and very often welcome to address that, to show your care and concern ongoing. Okay. Gap coming up.
I guess for me, one of the issues would be comorbidity. I have a girlfriend who was diagnosed with ovarian in her early 20s. She's now, because of the effects of chemo and radiation, she totally changed her diet, her eating habits, her nutrition, everything is now changed. Now she's having issues with cholesterol. So again, for her and her mindset, it was all about her cancer. And now 5 years out, she's now having to deal with all these other issues. She's a woman of color, so there are issues with high blood pressure and all the other things that go on. And so for her, she was very much sort of like, no, it's about my cancer. And now she's in a place where it's like, yeah, it is about your cancer, but also, and that not only are we talking about that cancer, but now you're increased risk for everything else. So just that, again, I guess I'm kind of like you, let's get it on the map, looking at comorbidities beyond just cancer diagnosis, because we are having survivors that are living long and having the same issues that those without cancer still have.
I hear you. And that one, we've got the gap, right? Okay, panel, oops, sorry.
Just a quick, someone on the panel mentioned the survivor clinics, and I wondered, they said there aren't any, or not enough. Are there any in New Jersey is my question. And I also can identify, because as a survivor, I was age 25, I'm 50 now, and now I'm finding out that I have leaky heart valves, high cholesterol, and it was my left breast that was cancer, and obviously the heart, I was radiated on that side for 6 weeks. Where do I turn for the info? Is it related? Is it not? And so these are issues, but are there any survivor clinics in our state?
So the gap, one of the gaps, just before we go on, one of the gaps is not knowing what are the resources for late effects for those sites that can really deal with not just acute, but late effects. Where are those resources? And there's a gap in our making that information available. Fran, did I hear you correctly? There are a couple in our state, and I'm not sure we're going to be able to cover the waterfront in this, but at least this audience could tell you about a couple of them that are available. Why don't we go ahead and break ranks for 1 second and say something about just where there are a couple of survival clinics. At Hackensack, at CINJ.
Mm-hmm.
CINJ.
There's two at CINJ, one for the pediatric and adolescent survivors, and then there's an adult survivor program as well.
Right. But I do hear you. There's not enough information about those that are dealing with late effects in the young adults.
I've been taking all of this in, and while I believe that, yes, there are problems that do come up the longer you live after a cancer diagnosis, my problem is that I have long-term health effects as a direct result of a cancer diagnosis and a recurrence. I've had issues with my stomach. I've had to go, to many doctors to try to have them look into it, and it was 1.5 years before the whole thing was diagnosed, and then I was finally referred to a specialist. I think there's a problem where regular doctors, not totally affiliated with oncology, they don't know of the possible effects, and that hinders us getting proper diagnosis on those issues as well. So
I hear you, a knowledge gap. And so now, as promised, I'll let the panel note a gap that may be different from those gaps that you've noticed. Please stay in the framework of noting a gap.
I'm not sure if this is where it should be, but I think you're talking about gaps in access to care, and I think that there's gaps in medical insurance as well. So I want to be able to identify that because this falls over many, many categories. And now I want to put my professional hat on to say I work for the American Cancer Society, and we are actually, and have historically, not just us here in the state of New Jersey, but worked really well as organizations together to collaborate. And there's a big movement right now collaborating on access to care with Senator Vitale. And so what I'd also like to do, I don't know if I'm really allowed to do this, Barbara, but besides acknowledging the gap, is to identify this as an action item to join the forces that are here today, to participate with us, to be able to make sure that when we're reviewing those things, that the insurance policies to make sure that folks have access to care, that what young adults need is included so that they can have it covered by their insurance.
So a gap may be that we're not always getting the word out about political agendas that could serve this young adult cancer population well. We're not always communicating that, and therefore leaves us in an impoverished position to be able to act in our own best defense. Would that direct itself to that gap? I think there's another one?
Well, no, I guess I wasn't acknowledging that way. I think there's a gap that I think that there's insurance gaps in terms of coverage.
Right.
And that is there a gap in us not communicating more effectively with each other? Is that what you're identifying?
It sounds like you're saying that there are some initiatives available in the state that young adults could get active in. So is there a gap in our communicating that so that they could get active in Senator Vitale and other initiatives?
I hope not, because that's why I was trying to identify it. So I don't know if there's a gap, because I don't know if the young adults here and the professionals that service the young adults even know that. So yeah, I guess there is a gap. Okay, sorry.
Okay, we've agreed there is a gap there. Okay, so just one or two comments from the panel, because we have 4 other items we need to finish in 32 minutes.
Real quick gap is just informing the young adults when they complete treatment that the rest of their lives could be plagued with crap.
Okay.
That was a little more than 7 words.
Right, but I think we got it. Yeah.
I would add to that several of the people that brought up the issue of lymphedema management and I say for most of my patients' sexuality, menopausal symptoms, it's really education. We don't have good treatment for lymphedema. So I think patients need to understand as they're finishing treatment that there are long-term risks and what those risks are, to be alerted to them, how lifestyle might need to be modified accordingly. And I don't think we do a good job. Someone said earlier, Regina said, patients drop out of this system of supportive nurturing during treatment into nothingness. And I think the gap is filling that void of information that patients can carry on and integrate into their long-term care.
Okay, so a gap in having that kind of follow-through. Anything else on this? You know what we're going to do with the last 3? They're such kissing cousins to each other, the last 3, talking about survivorship, talking about psychosocial issues, talking about supportive care issues, that I think that we might be creating too much of a contrivance if we pull them into their individual silos. So I'd like to direct ourselves to that whole domain, psychosocial, supportive care, and in survivorship issues. Where are there specific gaps that you know because you have felt those gaps yourself, or you know because you've been exposed to them? Mike, hold on just a second. We have a microphone coming.
Hi, I don't even know where to start. I'm a social worker, so God knows. But, you know, I guess if I could try to keep it as succinct as possible, is communication. And communication, I've done both the inpatient and outpatient side, and what I find a lot is communication amongst the healthcare team. That one person picks up on a problem and it's not communicated. So I don't know about a patient who's really struggling that I need to be involved with, that I need to, for whatever reason, So communication within the healthcare team, communication within the community providers. I was just referred a patient from literally a home health agency that their needs weren't being met in the home. And I'm saying, isn't that your job? But, I mean, besides the point, we had to pull together to try to figure out how to best help the patient. So I think communication is huge. It's a huge gap in a lot of different areas. So, just leave it as communication.
And communication, because we're talking about the psychosocial, the needs of survivorship-related information, in that domain specifically as well, that there's communication across providers that leaves them in a less robust position to direct themselves to the full-bodied needs that that person might have.
Right, and not so much just, I mean, that's why I say it's on so many levels, because it's not so much just communication between the healthcare team of what we see, but communication to the patient that it's okay to ask for help in these situations. It's okay to talk about what you're feeling, because there is someone that we can direct you to help, even if we ourselves can't help, whoever, we is as part of the healthcare team who you're speaking to.
Right, I know our panel will have more to add to that. But I'm going to ask them to hold back just for a minute. This one I know we'll all have a lot that we'll want to jump in with. But I'm interested also, are there other thoughts that you all have about in those psychosocial and survivorship domains, are there gaps? Gaps in what gets provided? Microphone's coming.
Hi, I'm Rachel. I work at Gilda's Club in Northern New Jersey, and I have a background in hospital social work and peds oncology. And it's interesting because we have a survivor clinic in the hospital that I used to work in. I remember I used to sort of not worry about those patients and families. I wish I heard this 10 years ago, because I would have been more concerned when they walked through the door. But what I'm wondering is, not only is there a gap for the surviving patients, but what about their families? I wonder how your family's been. Matthew, just to put you on the spot because you're up there, in the past 11 years, have they gotten the services that they needed? You don't have to answer it. It's just a rhetorical question.
If they had wanted to take advantage of them, they would have by now.
So
which is why I'm in therapy.
So I just want to make sure, thank you for that straightforward answer. The gap, I just want to make sure that we don't lose the gap. So just say the gap.
The families of survivors, are they getting the services they need? The parents, the siblings, the grandparents, friends?
I think.
Great. Is this a gap?
Yeah. There's a gap in knowing what's out there. There's an organization that has an online forum called Young Cancer Spouses. So, hey, there's something for a young cancer spouse, but do you know about it? There's a gap in knowing what is available and what is out there. So we need some place to know. Matt's certainly organizing a website. I'm Too Young for This. It has a lot of support organizations within the website, but we have a huge gap of not knowing what's out there. There are things out there, and
health resource literacy.
Got it. Other gaps. This is a big domain. Survivorship goes on.
Hi, I'm with Leukemia and Lymphoma Society. We're one of the agencies, like many in the room, where we provide support groups as a service. And I feel like I get a lot of conflicting information because on the one hand, we'd like to offer a support group maybe that's geared more towards the younger cancer survivor, because you get that complaint, well, I showed up and I'm 25 and everyone else in the room was a good 20 or more years older than me. But then sometimes when either our agency or a similar, organization talks about their attempt to get a group, sometimes it's successful, but lots of times it's not, because either if you are doing well, you're trying to get back to your life, or hopefully you're still working, so you're attending work, you're taking care of kids, and so kind of even that. I mean, I think the online support and the one-to-one, those are things that we as groups do anyway. But I think that there are still, that subsection of this population that might like a support group, but kind of. How do you do it? Where do you do it? And does it work? Or how do people feel when you try and set one up and you put all this work into it and 3 people show up? So I hate to pose a problem and not have the answer, because I don't like to just complain, but that's definitely a problem I think we're faced with a lot.
So So the gap then is, it sounds like, that there is this paradox of people seemingly wanting to be in same age cohort groups, and the paradox of then when you convene them, somehow we've missed something in getting the word out or engaging them to think this would be a good place for me or it's a good time for them or so on. So that that's the gap. Is that the gap?
Sometimes, yeah. Definitely there are groups that end up being successful, but not as much as our other groups. I think that aren't for that special age group.
Okay.
Hi, I'd like to address that, not with an answer, but more another question, which is, I'm not sure that that's the right modality for this population. Matthew, I'd love your input on that, but my sense is that we're thinking old paradigms to suggest that support groups are right for everyone, because my sense from listening and talking to young adult survivors is that the old-fashioned sit around in a group together in person doesn't work, that we need to think about online and other kinds of approaches that would be more appropriate. So I don't know, it's a gap. I think, because I'm Ellen Levine, I'm with the wellness community, and we too set up groups, and I'm in the enviable position to be able to identify needs and set up groups. And I know it looks like it's an unmet need, but I'm not ready to start a group because I'm not convinced that the young adults are going to come. We do a virtual wellness community, and there's a lot of young adults who are doing it online. So I'm not ready to start a group, even though there's nothing in our area, because I don't think that's the right approach for this population. But so I guess it's maybe a healthcare professional's unmet need to get a better handle on this. Seriously, because I'm not sure that we know what the right way is to support young adults with cancer.
Well, that's where I hear the
That's
gap.
the unmet need.
That's where I hear the gap.
Because I kind of agree and disagree, because I think it depends.
You need the microphone if you're going to agree or
Sorry.
disagree.
Yeah, because there's definitely pockets where you're like, yeah, this doesn't seem to work. But I mean, we've all had young people show up at support groups and stay with them regularly. We offer a lot of support groups, and we definitely have them, and they're asking for it. So again, but even like, how do you even explore the issue? I mean, you can't just ask the one person that's going to that support group, what do you want? It's like, how do you poll the people that you think might want a support group but aren't coming to a support group? So, if you were going to go to a support group, what should we do to make you want to do it?
You want to know what the best young adult support group is? A bar. Trust me.
Well, but we laugh when we think about that. I think this speaks to, we need standards of care. We need to know what works and what doesn't. And does that then write down a whole new definition for, this is the way you work with an older adult. This is the way you work for a little kid. You do play therapy with a little kid. What do you do with somebody in their 20s and 30s? I have a lot of support groups that run really well, and I've got a lot of people on my wait list for the next one, that the one's closed. But I do know, having done adult groups, I talk different. My energy is different. I'm different in the room. So is there knowledge that we need to focus on, or we need to somehow capture about what is different about engaging a young adult? How does it look? What's different about it? And I think that's a gap. I think you're right. I mean, it's not a traditional support group. It's a bit different. But what does that mean? What does that look like? I can't define it right now.
But there's a gap. Among the three of you, you really have, if you put together what all three of you said, there's a gap in our understanding what works for this group and what is the range of services regarding psychosocial and supportive care needs that works best for this group. And I think the three of you have, that thread runs through that. Would any of you be offended with having it paraphrased in that way? Okay, we're okay on that one.
I'm a cancer survivor, and I have definitely found that there is a definitive gap in opportunities for face-to-face contact with other young adult survivors. And it's true that, support groups, standard support groups don't really suit this age group. But I'm not a person who likes to go online. I like that face-to-face contact. And honestly, I went across the country to find it. I went to a place out in Montana where they have you went there? Oh, me too. Yeah. And they have a wonderful program, but it's 1 week in the summer and it's 1 week and a week in the winter, and that's it. And I mean, if you look for those things, they're so hard to find because they're not well advertised. The camps usually end at the age of 18, so they don't provide support for, older young adults. And so it's hard to find those things. And so they're not well publicized, I guess, is one gap. but also just the availability of them. I mean, I had to go across the country to find something like that. There's not really anything like that here. If there is on the East Coast, I didn't find it when I looked for it. So that's, I guess, just, you know,
There
making
are
those things available.
scores of social networking, camp, spa, retreat, public place networking opportunities for young adults that just didn't exist 3 or 4 years ago. And I've spent the last year organizing I'm Too Young for This.org with all of that content because it needed to be done.
Well, so then there has been a very big gap, and Matthew, you're working to decrease that gap in availability and communication of the availability of those face-to-face opportunities for young adults.
It's just they don't even know to know that there's access.
I hear. Other psychosocial, supportive, survivorship gaps?
So it's not because Barbara is a friend of mine, but it actually has to do with talking to a number of young adults with cancer and sexuality and their the social impact of sexuality on their lives is the one thing that's not always easy to talk about, and we have very little information on it, but it's one of the big issues that I hear from their part. So I wanted to ask the survivors here how and what needs they might have in that arena.
This is bearing your soul. But by the way, when you're thinking about that, just for a second, because Anne Marie keeps referring to me about sexuality, you should know that I'm a sex therapist when I'm not being a hospital administrator. So it's not in any other context that she is mentioning me and sexuality. I just want to be clear about that. I think, let me just rephrase your question in just a way, because I wonder, for survivors, how readily available was information to you on this topic as your healthcare providers were talking to you about what you might anticipate? No.
I remember I was treated in Seattle. I had a stem cell transplant, and I remember when I left, they gave me a whole packet of information, and I guess it was the women's sheet. It was on pink paper, you know, like sexuality after transplant, and it was in this like 1950s language, and it was like so arcane and just absolutely ridiculous. So in terms, I mean, that was available to me. I really think I mean, even though it's like these people see you like day in, day out, like in your worst state you've ever been, just the idea of talking about sex with, you know, a 6-year-old doctor man, it's just, you know, it's a little uncomfortable. I think if someone had approached me and said, like, this is an issue, let's talk about it. You know, what are your ideas? What are your fears? What about this? Then, you know, the floodgates would have opened. But just to have to be the one to bring that up was just really, just incredibly intimidating, so.
Absolutely. I'm just holding myself back from, you know, just quoting the research that supports that. The professional has to bring it up. It's not fair to, anyway. So, panel, you get a chance to say where you think the psychosocial, supportive care, and survivorship gaps are.
We've talked a lot about support groups and resources. I think the other important thing, both on a research and on a patient delivery end, are individual one-on-one counseling and psychosocial research issues. And I saw Linda Miller here earlier, and some centers are very lucky. They have a group that does psychosocial research, and they have a group that offers individualized, widely available one-on-one counseling for patients and oftentimes their families. But it's rare and far between. And if you're out in the community, and let's not forget that probably 80% of cancer care is delivered in the community, not at a cancer center. If you're out in the community, it's hard to find a social worker or a psychologist who has expertise in cancer issues. So I think that is a real gap institutionally and across the community.
The gap of knowing where are those providers. Not only are they good with psychological and psychosocial issues, are they good with them within the framework of cancer? Yeah. I hear you. That's the gap. Other panel members, gaps in psychosocial and survivorship issues.
I would say a gap. One of the surprising sort of side effects, no pun intended, but in when we launched I'm Too Young for This, which again is just a website of boutique content directed at the unique needs of young adults, including financial aid and scholarships and camp retreats and advocacy groups and coping literature, all in one-stop shopping kind of stuff, was that we got a tremendous buy-in from the oncology social worker professional universe. And I hadn't anticipated that being a gap that needed to be filled, because I had always assumed that, because you guys have so much free time, you could spend all day just memorizing thousands of organizations. But in the end of the day, this sort of helped give them just a one bullet sentence to tell their young adults who may or may not want to talk to them, or may be busy, or just want to get out of the hospital, that there's this really great website that has everything you need to know. And the buy-in was so dramatic at this point. Within 3.5 months, we're now at 162 cancer centers in 9 countries. So I think the gap that I wasn't expecting to fill, or hadn't even planned to, is getting filled, because we're helping build that sort of notion of what I said before, health resource or psychosocial health resource literacy, lots of words there, so that it makes the social worker's job a little easier, where you don't have to memorize 60 million things. Just, you need to know the American Cancer Society. You need to know leukemia and lymphoma, it's a blood cancer. You need to know I'm too young for this, for everything else. And in my vision, that's what I'd like. That's what I'd like it to be. So in terms of that gap, I think the social worker provider community needs to be made aware of the fact that there are all these things out there for the young adult population, but you don't have to memorize them all.
Well, I think that given your willingness to start us off by telling us the real truth, the real honest-to-God, you live it truth, we can allow you the luxury of being able to share with us that you would like very much for us to take out of here in our memory indelibly, that there is a website that you'd like people to access. I got it.
I have no shame.
Good. That's great. It's great. Okay, we only have a couple of more minutes, so any gap that hasn't been identified yet, so that we can end on time, of course.
I'm wondering also if we need to think about, is there a gap in young adults who are diagnosed in their 20s and 30s and young adults who are childhood cancer survivors. I think right now we kind of put young adults all together, and when I watch the two groups together, like it Can't Make a Dream or things, I think there's major and significant differences, and I think maybe we need to delineate that and think about that maybe in different conceptual frameworks. So gap in understanding the differences between childhood cancer survivors who are now young adults and young adults who are diagnosed in their 20s and 30s. Right now we just call young adults, but I think there's a difference. I know there's,
Great point. And any last thought on gaps? Gaps?
Oh. Just kind of a question too, I guess. Is there a gap? I hate to, boil it down to money, but and this may be a burden more on the centers, but is there difficulty in terms of if you are trying to get a person, traditional therapy relating to their cancer diagnosis, if you have great insurance and you have that PPO and maybe you can get that referral to that competent therapist in your area, but what if you don't? Or if your cancer center has a behavioral medicine or someone, are you able to bill your insurance for that psychosocial service? Does the cancer center kind of have to eat the cost? If so, is that going to, have an effect on whether or not that person's always allowed to, be on the staff, or are they going to be on the staff but have a caseload of 800 patients, that type of thing, all those, I don't know if a lot of that burden falls on the cancer center, but it comes down to money too. I know some centers, can't even have the specialized therapists, mental health resources right there on staff because the funding's not there, and if you're not going to get insurance reimbursement for it to provide those services, we'd all love to do it out of the goodness of our hearts, but that's hard to do.
So let me see if I can paraphrase the gap. I heard two gaps. One of the gaps is for the healthcare environment itself. Does it have a gap in the financial resources that it needs to provide the psychosocial services? And the second, for the individual, do they have an insurer who's going to make it possible for them to access those psychosocial services?
If they can't get those services for free through the center where they're being treated,
Right, or
then
through-
what are their, or wherever, through some kind of
organizations,
community
you-
resource, then
you and
know,
others.
what are their options if they're of limited financial means?
I guess this is a gap because I think that cancer care is probably little known, and I think we do fill some of that gap because cancer care, I'm not sure if everybody's aware of cancer care, but we do provide free professional counseling, and we are all trained oncology social workers.
So
just-
then the gap that I think has been acknowledged but needs to be reinforced is
Well,
that
I think the communication, again, we're back to communication and getting the services
Exactly.
out to known to all of you people that we do have these services. They are in this state, and it is a free service.
So for cancer care, for other organizations as well, the gap is, do we really understand both that the organizations are there and the range of services that they're prepared to provide? Well, a couple of things at this juncture. One is to thank you, the audience, because you've been able to really add to our knowledge base and to give us the tools to go forward together, collaboratively, to address young adult cancer survivors. So in ending, I want to ask you to thank yourselves. I will. To thank the panelists and